Hi, my name is Stephen Wallace. I'm a professor of public health at the UCLA Fielding School of Public Health. I'm here to talk with you today about the new federal public charge proposal for immigrants. On October 10th, 2018, the Trump administration formally announced a proposed regulation that would dramatically broaden the public charge test that has been part of federal immigration law for decades. The concept is that the U.S. does not want to admit immigrants who are likely to become, quote, wards of the state. This has been operationalized since the 1990s as those who have used and are likely to need in the future government cash assistance in programs like SSI or TANF or long-term institutional care. Those persons can be refused permission to enter the US and refused a green card. The proposal uses the new definition of public charge along with several other changes. This new definition would change from somebody who relies on the government as their main source of support to someone who participates in any way in a whole wide range of applicable health, nutrition, or housing support programs. So it greatly broadens the definition of what a person is who would be a public charge. Second, there are more factors considered. They will also now assume any public service user is at higher risk of being a public charge if they are also children, seniors, persons with limited English proficiency, a poor credit history, limited education, or a large family. So as you can imagine, that covers a lot of people. The proposal also includes a punitive new wealth test that would make it difficult for low or moderate income persons to become green card holders. And then third, they are expanding the definition of which benefits are included. The proposal expands to include as a public charge people who use key programs that provide no income support, but merely help participants address basic needs, including Medicaid, SNAP, also known as food stamps, federal public housing and Section 8 housing vouchers, as well as other programs. Each of these are critical to maintaining the health of immigrant populations. So what would this new rule do? Well, it would not reduce immigration, since immigrants come to this country for work or for family reunification, not for public benefits. It would not save the government money, because new bureaucracies will be needed to be established to enforce it. And it will not decrease the likelihood that those getting green cards will be wards of the state. So what will it do? Well, it will give new discretion to the immigration services that will increase racial discrimination associated with the immigration process. It will discourage immigrants, including US citizen children of immigrants, from using needed services. As we saw with the immigration law changes of 1996, there are likely to be chilling effects, even among those not formally affected by the law. This means that we'll have immigrants not enrolling their US citizen children in Medicaid, and therefore not able to get essential well child, preventive services, and early intervention, increasing the number of children in the US without health insurance and therefore developing health problems. It will drive families away from SNAP, even if there is only one potentially affected member in the family, decreasing the nutritional quality for all members of the family and putting them all at further risk for obesity and diabetes. And it will increase the number of immigrants in substandard housing because they refuse housing programs, leading also to worse health outcomes. In other words, it will worsen the health outcomes of a large segment of those living and working in the US and their families. So this proposed rule is open for public comments for one more week until December 10. If you want to add your voice to the public input, you can go to Protecting Immigrant Families, one word, protectingimmigrantfamilies.org, and that website will help you access the comment process. Each unique letter must be addressed by the agency who's making this proposal. So don't just add your name to a stock letter, but add your own opinions about the proposed rule in your own words. This is a small but important action that you can take as an individual to promote immigrant health. Thank you.